Now, if you're pregnant, the lead up to your due date and the labor itself can be a pretty overwhelming experience. And some mothers-to-be have turned to doulas for support during this crucial time in their lives.
Besides preparing their clients mentally and physically for labor, doulas also talk them through their birth choices. So how is a doula different from a midwife, and how will they interact with medical staff and your partner? Well,
joining us in studio to talk more about this today are Leila Singlet Caceres, the founder and doula at Lemamasita, and Carolyn Bay, who used a doula during her recent pregnancy. And also with us is Dr. Tan Eng Kien, obstetrician gynecologist at EK Women's Clinic. Welcome to the show, guys. Leila, let's start with you. First up, what exactly is a doula?
Thank you. A doula is a childbirth coach, your personal labor assistant. We're there from the beginning to the end to care and support for you, for crafting your birth plan, to letting know your birth choices, deciding for you what's best for you. And during labor, we provide you with your emotional and physical support for both you and your husband, holding space for you. And thereafter, when the baby's out, we help with breastfeeding and newborn baby care. All of this used to be done within the community of women in your tribe or your village, where birth happens on a day-to-day basis and they experience that. But in today's society, where birth happens behind closed doors, there's so much uncertainty and fear surrounding it. So doulas are here to bring that community back, to help empower parents have a positive birth experience. Most women who report positive birth experience actually want to have or plan to have more kids. And in Singapore, we want to have more children.
Yes, we do. Yeah.
But the thing is this service that you're providing becoming more and more popular?
Oh yeah,
this
definitely.
This is the first time I'm hearing of it.
Yeah, actually, if you asked me 2 years ago, I have no idea what a doula is.
Yeah, I didn't have any idea.
So it's definitely growing, and the amount of doulas in Singapore are actually growing too.
So, Carolyn, we understand that you just gave birth earlier this year,
yes,
and you used a doula during your pregnancy. What made you decide to do that?
Honestly, we hadn't thought about it. It was something that, we thought it was a nice to have until in my 39th week, the doctor, my then doctor, my obstetrician, was pushing us for an induction. And we'd spent like a lot.
39th week? That's really late.
So, right, 1 week before I was actually due. Yeah. And so in that final week, she was pushing us for an induction, which was, we'd worked on this birth plan. It was really, for me, it was all about sort of natural birth. I was trying to do what I thought was best for myself and for the baby. And, but we realised we just didn't have the knowledge or the experience to make decisions, right? It was our first baby. So we contacted Leila, and it was way more than that, but actually was intended for us to have that, that experienced person around who would be able to help us understand like what our options were. When a doctor or a nurse, you're in this, I guess it's sort of a one-size-fits-all system, in today's the way that we do births today is a one-size-fits-all system. And so every time you're wanting to make a decision, it's generally sort of against that sort of standard process.
Right.
Yeah, so that's why we
decided to go with a doula.
That's right, we decided to go with a doula.
Dr. Tan, let's bring you into the discussion. Is this something that you're seeing more and more in the theatre when you deliver children?
Okay, I think more and more of my patients are opting to have doulas. I think one of the main reasons is that in hospitals, the midwives actually work in shifts.
Right.
So it's very difficult for the same person to provide the one-to-one continuous support.
Right.
So doulas fill in this gap, providing one-to-one support during labor. And there's research evidence to show that with one-to-one support during labor, whether it is a medical person or a doula, actually helps to reduce interventions. So it lowers the chances of needing an instrumental birth.
Right.
It lowers the chances of cesarean birth. Then it shortens the duration of labor, as well as reducing the amount of pain relief needed in labor.
And you're saying this is proven?
There's research.
There's research, wow.
I can tell you that there is no way I would have had a natural birth without a doula.
Wow.
What does the husband do?
I had cesareans too, and I mean, well, anyway, that's too much info, I know. But talking about the intervention, less intervention, and the role of a doula. What does a doula not do? Because you're working in tandem with the doctors and midwives as well.
Yeah.
So what do you not do?
So we do not do anything medical. We're non-medical professionals. We do not make any decisions for the client. We're there as advocates, as cheerleaders, to help the client get whatever they want and to support them. And the biggest misconception that a lot of people have for doulas is that we're only for natural drug-free labor, but we're actually there to help you get what you want.
So epidural is fine?
Epidural is fine,
Okay,
cesarean is fine. You know, it's what you want, and we're there, and a lot of parents actually feel supported even through a cesarean.
Yeah, I'm just wondering whether there's going to be a conflict as well, whether the doula may say, look, this is something that needs to be required, and then there's conflict with the obstetrician or the gynecologist.
I mean,
what would you say,
even
Dr.
difference in opinion can happen between
Sure, yeah.
doctors.
Yes.
Difference in opinion can happen between midwives. But the doula's role is a non-clinical role. They act as supporters and advocates for the woman. So I think it is important that when there's a difference in opinion or views, to listen to the laboring mom and her doula. And if there are any safety concerns with the mother or the baby, I will explain the rationale for my recommendations. Right. So we try to work in teams, to make the labor journey a memorable one for the laboring mom. Yeah.
So Carolyn, would you go for a doula again if you were to plan for a second pregnancy?
Without a doubt, like 150%. It was, at the end of the day, what made it a good experience. I think you hear so many people with bad, stories about birth, and
And there was the postnatal support as well.
Yeah, actually, that's a really good point. I think that's completely underrated. So there's somebody who looks after you from, what do you want your birth to be until afterwards. And I followed quite a few friends who'd had babies recently, and they had challenges with breastfeeding or like baby blues, and having somebody that you can ask questions to. I mean, how the hell are you meant to know what to do? It's the first time.
But the problem is this as well. Then you have an attachment, but you've got to go through a certain period where you have to detach yourself from the doula.
No, I didn't find that to be the case, actually. Okay. I thought that having someone that you can ask if you need it, and Layla came and visited me 3 times at home. So you're in your house, in your comfort zone, you're working out how to do things. But there's lots of little things that you just like.
So she really feels like a friend.
Yeah,
friend to you.
Somebody who actually cares about you.
Just very quickly, Layla, before we go, what would you say was your most interesting birth experience so far?
I think it was actually with Carolyn and Nat during the labor. So we were laboring at home.
Laboring at home.
Yeah,
okay.
and it was go time. So we were going to the hospital, and we all got into the car. And I was coaching her on her breathing, and she was in the back. And I turned around, and we were on the way to Buena Vista, actually, to where he was autopiloting to his office.
Yeah, my husband was taking us to work.
Oh my gosh.
So I took out my phone and I redirected us back to Novena. But it goes to show that no matter how prepared you are for that day, just to have an objective person to guide you and to hold your hand and just to be there for you is so important.
Thank you so much.
No problem. Thank you.
Thanks so much, guys. Well, we've been speaking with doula Layla Singlet Caceres, Carolyn Bay, and Dr. Tan Eng Kian. Thank you so much all for coming today.